How long does it take to start a new medical practice? This is a common question that we get at Collaborating Docs. Lots of nurse practitioners out there are excited and ready to dive into entrepreneurial endeavors, starting their own medical practice, but a lot come to us asking, how long is this process going to take? The answer is, it depends. No one likes that answer, so I'm going to break it down into something a little bit more concrete. If you are able to push things forward, be aggressive, put in a lot of time, we're talking a few weeks. If you're juggling a second job or a lot of other responsibilities, home life, we're talking a few months. It's usually weeks to months. That's a little bit, hopefully, more specific and helpful than saying it depends. So let's break apart how this could look. Hi, I'm Dr. Annie DePasquale, the owner and founder of Collaborating Docs. We help entrepreneurial nurse practitioners find amazing collaborating physicians. Today is all about how long will it take to start my medical practice? I have a great idea, but how long is it really going to take to get it off the ground? So we're going to break it apart looking at this handout. So we created this a few months before the end of the year to give people a guideline for if you want to start January 1st, like a lot of people, a lot of New Year's resolutions, everyone wants to start their practice January 1. We backed things up 3 months. And these are the things you would need to think about doing 3 months before the launch, 2 months before, and then 1 month before. Now, pro tip, you can change the word month to weeks if you can be, as I said earlier, aggressive, hardworking, pour a lot of time into it. We absolutely have had clients get things up and running in weeks, not months. So you decide which path you want to take, turbocharge it or slow and steady. Either way is fine. Just kind of know yourself and know how long it takes you to get things done. So either 3 weeks or 3 months beforehand, you need to do planning and preparation things such as concept, so business idea and legal considerations. Then you need to focus on budgeting and finance. How are you going to pay for this? Then you work on your licensing and accreditation. Hopefully you may already have your licensure, so that is already done. Then you need to worry about setting up the facility and equipment. This is a pro tip. Consider doing telemedicine because the setup is obviously much less. You don't need office space or equipment. 2 weeks or months before, now you can focus on supplies and marketing. Week 5 on here says marketing and branding, which is probably the most underrated part of this whole endeavor. It is essential for success, yet a lot of people slide right by and don't focus on the marketing piece. I highly recommend you get someone on your side who knows what they're doing to help you get paid ads and SEO and the website and all the local advertising going. Week 6, you can focus on regulatory compliance and protocols, your EHR, getting all the malpractice lined up. Then you still want to consider getting supplier relationships going, especially if you're going to offer like IV hydration or aesthetics. Now it's time to focus on staffing. So who's going to be at the front desk? Who's your MA? Do you need a nurse? Do you need other providers? 1 week or month ahead, you're going to do the final touches on the operations and you're going to launch. So regulatory compliance, make sure everything is up to code, up to inspection. Then you can do a soft launch. So get just a few special patients in the door. Maybe it's family and friends or neighbors, people to test and try some things out. Are they waiting forever in the waiting room? Are they get their feedback, see what they have to say about the experience in your clinic. And then the final bit is to do a fabulous grand opening. Marketing can help you with that. Get people excited, get them really in the door, hooked on what you're offering. and make sure you're getting feedback. What do they like and not like, and make immediate changes to improve upon it. So it may seem very, 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 very daunting to start your own medical practice from scratch, but I encourage you, you can do it. Many have done it. We've helped thousands of people do it. At least the part of finding a collaborating physician and advising on some of these other issues. It's just a checklist. It's just a matter of going from top to bottom and getting everything in order, done, and making your dream a reality. I wish you all the best, and I'll see you next time.